critical that we have Aboriginal community controlled disability services because with things like the National Disability Insurance Scheme, it's going to be vital that our people with disability get service from their own community members, frankly. We're very concerned that there's not enough registration happening under the NDIS for Aboriginal organisations. And we also know that we're the ones that have the knowledge and the understanding of how to provide proper services, appropriate services to our people with disability. So we think it's really vital that we have more Aboriginal organisations becoming part of the National Disability Insurance Scheme.
So some of the work that we've done with the Australian Bureau of Statistics says that there's about 60,000 Aboriginal and Torres Strait Islander people with disability in Australia. Now, this is not a number that's readily acknowledged in the policy. So if you have a look at things like the Closing the Gap framework, or you have a look at the National Disability Insurance Scheme, they're not really getting down into the nitty-gritty and saying, what is the data? What are the numbers telling us about how many people there are and what does disability look like? And I think that's where the new frontier of this research is, how do we actually provide an inclusive model of disability support which does understand the social environment that people live and understands the culture.
We need to fill in the gaps of service provision if it's to do with housing, support coordination, or any of those registered groups through the NDIS, to try and fill in those gaps, because to meet the unmet need because of the large scale. Also, we know how our mob work, how our people work on the grassroots level, because we always want to be from the inside looking out, not from the outside looking in.
There is an opportunity to grow your organisation too, potentially, in the sense that with a different level of funding, and once you learn how to use that funding and use this new system, it could mean down the track that your organisation's more got a longer life, if you like, or doesn't have to perhaps stress just as much as we have in the old days of block funding.
But also it's creating a workforce in your community. And we think this is really important that, particularly in rural and remote regions, that, if we have our own working in community, providing services in our community, the market for our Aboriginal organisations can only move forward and be more financially viable. So I think the first steps for any Aboriginal organisation is to come together and talk about this with your community. Talk about it with your boards, that they need to understand that there's a market here. And once you've had these conversations and understand what currently, the skills or services you already have available in your organisation, you can make the steps then forward to register with the NDIS. Think about, how important this is, that we have Aboriginal organisations registered on the NDIS to support our most vulnerable in community, who are Aboriginal people with disability.
Just would encourage organisations to seek help. If you're not sure about something, doesn't matter what the question is, get in touch with the First Peoples Disability Network or get in touch with the National Disability Insurance Agency.
The NDIS is rolling out, so jump on board. There's plenty of opportunities to get amongst it, whatever realm of the disability organisations that you are coming from. As you would know, or if you don't know, through all the states and territories, all that's rolling out, and it's going to be federal, which is the NDIS. So get on board and live large and take charge.